Hello and welcome to another episode of the Health Notebook. Today we're discussing skin cancers, in particular melanoma, and we have Dr. Gantsho in the studio. Dr. Gantsho, welcome.
Thank you.
Dr. Gantsho, as we know that you're a dermatologist, can you just tell us a little bit about yourself?
Okay, so I was born in the Eastern Cape. I am now married and I'm a mother, and I also work as a dermatologist in Cape Town, Century City based.
Okay, so where did you do your undergraduate degree and your postgraduate degree, and how many years after?
Okay, my story is very long actually. Okay. Before I became a doctor, I first did my BSc with honors at the University of Fort Hare, and then I continued to do my master's at the University of Pretoria. While I was there, then I did my medicine.
Okay.
And then after doing my medicine, went back to the Eastern Cape to do my internship and my community service. I got married, then I moved to Cape Town where my husband was. Then I started by doing general surgery because I really love general surgery. And then I did that for about 2 years. Then it was just too hectic for me, so I wanted, because I was married, wanted to start family and stuff. So I changed over to dermatology, which I did at Groote Hospital under University of Cape Town.
Okay, so in total you probably have about 4 or 5 degrees, is that correct?
It's 5, then plus my dermatology, it's 6 now.
It's 6 now, that's
yeah.
excellent.
Yeah.
Okay, so what made you move, besides not liking surgery, what made you actually go towards the field of dermatology?
While I was doing my internship and my community service in the Eastern Cape, I used to come across people going to the dermatology clinic, which was close to our general surgery clinic, and I was always fascinated about what they have on their skins. And that really fascinated me and developed interest in the field of dermatology. And as time went by, I realized that dermatology was not just the skin, it was more of skin deep, because some of the people that have got internal problems, you can see them through their skin, like people that have got diabetes, the skin size associated with that, and also people that are immunosuppressed. By just looking at their skin, you can be able to tell what is wrong with them.
Okay, so what you're actually saying is one shouldn't view the skin as a separate organ. One should actually see it in combination in relation to other organs. As you've mentioned, diabetes can also give you skin problem, some of the skin problems. What other illnesses can you just highlight, medical problems that can be related to skin problems as well?
Cholesterol as well. When one has got high cholesterol, usually when you look at them around their eyes in the middle, you can see the white spots. That's a sign that they have a high cholesterol. And also people that are immunosuppressed, usually they present with, it's like a long list of skin signs that those people can have. So it's basically everything. A person can have porphyria. And by the way that you can know that it's got porphyria, they are photosensitive, sun sensitive, so they can develop blisters on their sun exposed areas. So it's a very broad area, and as you know, skin is the largest organ of the body. Okay,
so going back to our topic, we're speaking about skin cancer. How common is skin cancer in South Africa?
In South Africa is very common. The stats were done a couple of years back now, so we don't have the actual stat now. But what I can tell you, South Africa, when it comes to skin cancers, is number 1, followed by Australia. And reason for that is because Australia, when it comes to giving people information, and also when it comes to sunscreen use, they do subsidize their people, which is something that in South Africa we're not aware of.
Okay, so what you're actually saying is that the government provides some type of monetary benefit in Australia to make the cost of the sunscreens less.
More cheaper, yes, that's correct, which is something that we don't have in South Africa, because I'm sure it's because government doesn't realize how important the skin is, and also how common the skin cancers is.
Okay, so just going again to the topic of skin cancers, can you maybe just give us some examples of different types of skin cancers?
Okay. I can start off by saying there are 3 major skin cancers that one can get, and all the skin cancers that I'm going to mention, they are divided according to the type of skin cell that they do affect. The most common one is a basal cell carcinoma. So basal cell carcinoma, always call it the safest skin cancer to have, because once one has it, except for around the nose, it doesn't go somewhere else. It stays where it is, and it's easy to treat.
So it's limited around the area?
It's limited around the area, except, as I said, close to the eyes and also around the nose where it can go down. Okay. There are also different types of basal cell carcinoma, but though basal cell carcinoma, it does affect the basaloid cells of the skin. And then you get the squamous cell carcinoma. Squamous cell carcinoma is destructive.
Okay.
So it does affect the squamous cells, and that one you usually get it in people that are albinos.
Okay.
And people that do smoke. So they usually get ulcers around their mouth, and it's usually the squamous cell carcinoma. And as I said, those ones can be invasive. And then you get the one that is a deadly one, which is a melanoma. So melanoma, basically what it is, it affects the melanocytes. Okay. So why is it so dangerous compared to the other skin cancer cells that I've mentioned, is because it does spread. So it's spread through the lymphatic system, okay, and then it can go to other areas.
Okay. When you mean, okay, just going one step back, what actually goes wrong in the cells? I know you've spoken about the basal cell. Mm-hmm. We've spoken about the squamous cell, which is a particular type of cancer. Mm-hmm. And then we've also got the melanoma. But what actually goes wrong within the cell? Is there some interruption of communication, or can you just some broad idea?
So basically what the sun does, because everything starts with the sun. So what the sun does, it changes the DNA of the cells. Okay. So as I've mentioned before, that it's a specific cell type that gets affected. So the sun causes a disruption on the DNA of the cell, and basically the cells just become cancerous. So the cells become abnormal.
And they continuously divide.
Yes, okay. And they continue to divide, and then they cause those abnormal cells, which ended up being skin cancer.
Okay, so I know you've been speaking about the sun and it's being one of the risk factors for causing melanoma. What other risk factors are there for skin cancer and in particular melanoma? Okay,
and then when it comes, especially with melanoma, all other skin cells as well, you'll find that there is a family history of. So with melanomas, you get 3 different types of melanomas, and they are genetically the melanomas. And then with the 3 different types, because people always, even though I've mentioned that it's all about the sun, but you can get the melanomas that are associated with sun-exposed areas, and then you can get the ones that you get on the body, which are covered areas, and then you can get the melanomas on the palms and on the soles, and those ones are mostly common in black people. Okay. Yeah, so it's important. It's not only for Caucasians, also African people do get melanomas.
So there's a wide variety of population groups. It's not restricted to a certain ethnicity group. What about UV lights and sunbeds and tanning? Is there any role or is there any link between those particular aspects of UV light and skin cancer?
There has been some research that has been done that does show that there is an increased risk to people that use UV beds or use sun tanning. Even those that use sun tanning spray, there has been a high risk associated with skin cancers with those people.
Okay, and do you think that if one does go to a sunbed, there should be warnings on these particular beds to make people aware that if they're going to spend too much time? Do you think that would be actually feasible?
All of them, when they are sold, they do have those risks. As part of whoever buys them, they know about those risks. It's just that when people go to those areas, they are not told about them, or if it is there, it's usually a fine print at the bottom that people are not even aware of. Okay. So nobody really monitors them about the risk or tells them about the risk.
So how would one know that you have a melanoma? How will it present? Will I have something wrong with my skin? Is it a dark spot, a light spot? Can you just tell me something about the signs or the symptoms? Or,
okay.
yeah.
So basically how I put it to my patients as well, melanomas, they can develop from what is commonly known as moles. But sometimes melanomas can just develop out of the blue. One didn't have anything.
Okay, so when you mean by a mole, it's the black spot?
The black spot
spots.
that one does have on the skin. Some of the people they are born with, but others they develop later on in life.
Okay.
But basically the way that we look at it, we do the A, B, C, D, E, which basically means when you look at your mole, you must be able to cut it in half and fold it together. If you see that there is some asymmetry, that means that there's a problem with your mole.
So when you look at it, you need to be able to say this is a half a circle and that is a half a circle.
Put them together. Yes, put them together. And it doesn't have to be like in a straight line, whatever direction that you take, you must be able to fold it together. If there's any asymmetry, then there's a problem. And then B, when you look at the mole, you'll see that it's nicely round. But then when you start seeing that the borders become irregular, then that's a problem. Then there's a problem with your mole. You need to consult a dermatologist. And then with C, people always have a thing of saying that my mole has become dark, then it's a problem, I need it checked. But some melanomas don't have color. So C basically stands for a color change. So if your mole becomes darker or if your mole loses color, then it's a problem, you must consult. And then D, we say a diameter of up to 6 millimeters is safe for a mole. But if your mole is bigger than that, then it's a problem. However, there are some people that have got moles that are bigger than a 6 millimeter, which is once checked, they are fine. Then there's nothing to worry about.
Okay. So what you're actually meaning is that if it's over a certain size, you need to be you need to have it checked out.
Yes, that's why it's important to always check your moles. And then E basically means if there's any evolution on your mole, that means any changes. So it's important be aware of how your moles look like. And then there's 2 that have been added to the list.
Okay.
F, which is funny looking. So if you see your mole from the others, it looks different,
so
then
you need to
worry.
Okay, I've got one on my hand, I've got one on my arm, and do they look the same?
Yes.
Okay.
But again, for some people, they have what we call funny looking moles, which we usually refer to as ugly duckling.
Okay.
So out of one's moles, one will always have an ugly duckling, which is a mole that stands out of all the other moles. But it's important, don't just say, no, this is my ugly duckling, always go and have it checked. Okay. And then G stands for rapid growth. So if you see your mole used to be small, but now all of a sudden your mole is bigger, always go and have your mole checked.
Okay, so what you've given us, what you've actually given us is a summary of the most important factors that one actually needs to be made aware of if they do suspect a particular mole.
They are mole, yeah.
Okay, so you've been to the medical practitioner. They say that you have a possible melanoma. What's the next step? Are they going to remove that particular mole, or what's the next step afterwards? Okay,
so if you have seen a dermatologist, because GPs, they don't have a right to make a diagnosis of a melanoma. So you go and see your dermatologist. Your dermatologist uses an instrument that we call a dermatoscope to look at your moles, or can also do mole mapping to look at your moles. There are certain features when you look through the dermatoscope that tells you that this mole is abnormal. And based on those features that you find, then you can decide if the mole needs to come out or if the mole can just be washed.
Okay, so what you mean by washed?
Okay, so there are what we call atypical moles, which means it's a mole, but it's not a melanoma. At the same time, it's not a normal mole. Yeah, what one needs to realize is a mole can be there, not be normal, but it doesn't mean that it's going to be a melanoma, because we worry about melanomas. But it doesn't mean if you take away all your atypical moles, then you're going to be melanoma free. It doesn't work like that. So that's what I'm referring to. You can have an abnormal mole, but it's not a melanoma, and it's not necessary to take it out.
Okay, so what you've also mentioned before is that there is a possibility of removing that particular mole, and then once you remove it, are you going to send it away to verify that this is a melanoma, or?
So depending on the size of a melanoma, if it's a small size melanoma or suspected mole, a dermatologist can remove it, and also depending where it is, one can send to a plastic surgeon to remove. So what we do, because we have to get a definite diagnosis, you remove it, you send to pathology so that the pathologist can look at it, and then they can be able to tell. And it's also important, once you have had the results, do communicate with your patient so that they can know which one was it. Because by just removing, when people come for a follow-up or go and see another dermatologist, they'll always tell you, yeah, I had the skin cancer, but they don't know which skin cancer was. So it's very important that you let the person know which one was it. Because also melanomas, you get your superficial one, and then you get the ones that are deep, spreading deep. So it's important to know.
I know with the other cancers, they would normally label it as stage 1, stage 2, stage 3. How, I mean, is it a similar way that they would classify melanomas, or?
Okay. For melanomas, the staging is different, and the only people that can give you the staging are the pathologists. So melanomas are basically staged according, the first look at it, is there an ulceration or is there not an ulceration? So that's a point for them when they do their staging. And also they look at the depth. How deep does it go down? Remember I said melanoma develop from melanocytes. So now they look at that, and also they'll be able to tell, is it just a superficial spreading melanoma, or is it an invasive melanoma? So those are basically the things that pathologists can be able to tell. So there's a number of
criteria that they actually look at.
Yeah, but only pathologists can be able to tell you that.
Okay, so let's assume you leave the melanoma and it becomes invasive. What are the complications? I'm just saying, I mean, if it is left untreated, what happens to a person? And we know it's skin cancer, so what are the complications? You've mentioned something about spreading through your body, and what's the end point then?
Okay, the first thing I mentioned was like melanoma is a deadly form of a skin cancer. So once one has got a melanoma, it's important, it needs to be taken out. And also another thing that I didn't mention, when it is removed, you have to have clear borders on the sides and also going deep in. You must make sure that there's nothing that is left behind. So once one suspects that they do have a melanoma, it's important that it needs to come out. So you cannot leave a melanoma, because melanoma is deadly. As I've mentioned before, it's spread through your lymph nodes. So for some people, by the time they even find the primary lesion of the melanoma, it has spread to their brains as well, and then the person is dead. So they say, okay, melanoma, but where was the original? So it's important, if you have a funny looking mole, go to a dermatologist, not to just a general practitioner.
And with this as well, so you've had the melanoma removed. That's not the end of the story. You still need to continue your follow-ups on a yearly basis or 6 monthly. Is that correct?
Okay, for a melanoma, if a melanoma has been found, it's usually important that you go for a follow-up a month, 3 months, and then it increases to 6 months visit, and then to a year. Your dermatologist will be able to determine how often you need to come, but it's very important that you go for your follow-ups. Okay. Because your risk now increases after you've had your first melanoma.
Okay, so just to give the viewers some type of idea, you're seeing a patient with a possible small melanoma. How is it going to affect his life? Can it just be removed, and can you go back to work the next day, or what's the whole process when you remove the melanoma?
Okay, so it firstly depends on the size. What size was it? So if it's maybe on the body, it can be easy to just remove it with the clear borders. you remove it, and then you can close it up if it was a small one. Usually the ones on the legs and on the face, after removal, depending on the size, as I said, and which type of melanoma it was, usually people do need to have a skin graft or flaps, depending on what procedure was done. So a person cannot go immediately to work afterwards, but it's not something that can take one out of work for like a month or for a longer period of time. It's usually a matter of a couple of weeks, and then or a 1 week, and then one can be able, but as I said, depending on the size of what was removed.
Okay.
And it's procedures that can be done in outpatients. One doesn't have to be admitted in hospital.
Okay. Just going back to one of the other cancers that you've mentioned, the squamous cell. Just give us a little bit of a comparison of that particular cancer to this particular melanoma here. Just 1 or 2 highlights about that.
Okay, so melanomas, I said they develop from the moles, from melanocytes basically. So it will be a mole, and then it will become like that. And then one doesn't necessarily have to have a sun-damaged skin. But with squamous cell carcinoma, it's ulcer. It will be like a fungating ulcer that one has got, and it will be on a background of a sun-damaged skin. And squamous cell carcinoma and the basal cell carcinomas, they are associated with sun-damaged skin, but melanomas are not necessarily associated with sun-damaged skin. And melanomas, they do ulcerate as well, but their ulcer, it won't look as angry and ugly as squamous cell carcinoma looks, and also basal cell carcinoma.
Okay, just to sum up, we've almost reached the end of the show. Can you just highlight to the viewers the most important take-home message so that they are aware in terms of skin cancers and melanomas?
Okay, number 1, sun protection. It's very important that one does use sunscreen. People always say they stay away from the sun, but it's not really possible to stay away from the sun, because the lights that we use in offices also have got a UV. So it's important that people get accustomed to using sunscreens, and one needs to check when they buy the sunscreen that is the right SPF, which is the sun protection factor for their skin. And also,
how much should it be, the SPF?
It depends which race you are.
Okay.
For an African person, SPF of 15 will be fine. And then when you look at Caucasian people, depending what, I always tell them about their hair color, what hair color they are. If you are just a brunette, SPF of 30 is fine. But for people that are albinos, red-headed people, those people that are not protected to the sun, basically SPF of 50 is fine for them. But the best way to determine is when you go out, how quick do you burn when you are out in the sun? So that will tell you what SPF you have to put on. And it's important that your SPF protects you against UVA and UVB. And also, it is important that one knows that when they are out in the sun, they need to reapply their sunscreen every 2 hours. So it doesn't mean because you've put it in the morning, then you are protected.
Okay. Dr. Gantsho, it's been a pleasure having you in the studio, and we hope to see you again. Probably one of the next topics would be skin lightening creams and what impacts it has on the individual. Thank you very much for being here.
Thank you very much for inviting me to your show.
Thank you very much for watching. Stay tuned for another episode of the Health Notebook, same time, same place.